I want to make sure everybody's sort of clear on this concept of how I treat gynecomastia. So you have gyno, right? It's the female-like appearance of a breast in a male, all right? And that's, we finally got that down. We know gyno is real, and I know it when I see it. It doesn't mean a specific feeling of the tissue or anything like that. What type of tissue it is. It's like you could just tell there's breast that shouldn't really be there. And so if you fall into this category of having this gyno, well then, okay, so then what are the options? How is your gyno treated? And the reason why this is important, because everyone's a little bit different, all right? You have the standard zone 1 gyno where it's just up front, then you have multiple zones. You have people that gained a lot of weight, they lost a lot of weight. You have people that have huge, true big breasts, and it's like, okay, well, what do you do with that? Now, the interesting concept with that is that they're really big. A lot of doctors who may not be familiar with gynecomastia, they're like, oh my God, this is like a female breast reduction. And female breast reduction, the way I approach that is entirely different than a gynecomastia. And this is really an important point for everyone to understand. The average surgeon, when they see a female-like breast, they want to reduce them, and they reduce them with scars. You know, it's either a lollipop scar or maybe an anchor scar, okay? That's the female breast. And we always reduce them in a certain way. And sometimes after I've done so much gyno, I say, well, why do we have to reduce it this way and make these scars? Well, what we're trying to do is take maybe a bigger, flatter breast, right, and making it more conical, okay, so that it's just shaped more narrow and perky instead of like this kind of sad shape, all right? So that's part of the reason why we do that. But that's not really the issue that comes along with gynecomastia. It's a lot different. I don't necessarily want to put scars on these patients' chest at all. I mean, I want you to feel good with how you look in the mirror when you walk out of the shower and you're naked, right? I can make everyone look good. You know, I can make all guys look good with a shirt on, okay? That's easy. I mean, you just reduce things. But what if you have scars and wrinkles and kind of, you know, contour irregularities? That's a different story. Maybe you're not going to feel great about having your shirt off. That's why the ultimate litmus test, the thing that I hold myself to, is like, I want you to rock out of the shower, in that mirror, and I want you to rock at the beach. I want you to just feel good about feeling good in front of the opposite sex. How about that? And feeling that you got some mojo going on. All right, so you have the gyno, and then you have the first separation right here, and this is the skin removal, okay, and the non. All right, the non-skin removal basically is my standard treatment: small incision in the axillary area, small incision under the areola, do my vasor, do my liposuction, take all that stuff out. I anticipate here that the skin is going to retract back and all that kind of stuff. And if it doesn't, let's just say there's some people I'm not really sure. Well, the good thing is then it's a stage procedure. If you do well and say yes, great, happy patient, life goes on. If it doesn't for whatever reason, and it's sort of like a little bit more of a saddy face, it's not that it isn't different. You definitely look a lot better than you did before. And if you wear a shirt, it looks amazing. But if you have some irregularities, that may put you into that skin category, which basically means we remove skin. But if you take this route here, I'm just saying, okay, typical patient like this patient, he lost 130 pounds. He's saggy. I don't think that skin is going to go back well. And in fact, he may even say he wants a tighter chest, okay? He just wants it, okay? Because a lot of times people who lose this kind of weight, they don't care about scars. In fact, in his case, I'm going to go back and remove a big area on his abdomen as well, because that's also where he has some loose skin. So skin removal is a different story. That's going to be scars that go across the chest. That's going to be a new nipple areola complex that could be pedicled or free graft like this video. But they're definitely going to be bigger scars. You know, we can have a debate, and there's a lot of uncertainty on where to put the scars or how best to configure this particular operation, but suffice it to say that this avenue here is a bigger way to go. The recovery is going to be longer. It takes more expertise. It's bigger surgery, and so this is the first sort of pathway that you have to go down. You have gynecomastia. I mean, most people, I'd say in my practice, probably, oh my God, 95% of patients are in this category, non-skin removal, and 5% are in skin removal. You can imagine if I was associated with, let's say, a big medical center that does bariatric surgery, which is surgery for obesity, and you're exposed to a lot of patients that lost a million pounds, you're probably going to do more of the skin removal in that category. But for my practice, pretty much a global practice from people all over the world, I'm actually fortunate enough I can review your case online and sort of size it all up, and then decide with pretty good accuracy that you're going to be a non-skin removal. Then you're going to go into this pathway over here, and then generally everybody does pretty darn good. Like I said, if it's imperfect or you want a higher degree of improvement, you can always swing back. In fact, you may see some doctors that say, I'm going to do you in 2 stages, which basically means I'm really not sure how that skin is going to go, in which case we're going to go down this pathway. That's stage 1, and then let that heal up, and then stage 2 wraps around, okay, and then we do the skin removal. I would say that with my judgment, I could probably avoid the 2-stage. I don't need the 2-stage for the benefit of keeping things. A lot of people just don't have the kind of experience. I mean, you can do this in 1 stage and get a nice, reliable result. It's not going to hurt you to do it in 2 stages, by the way, but if you don't need it, what's the point? So the moral of the story, the take-home message is this, okay? If someone suggests to you that you need to have skin removal, I always say visit several doctors, okay? Get different opinions, because what you don't want is skin removal and these permanent scars when you didn't need them. And I see that a lot, so you got to be really careful here. I would remind everyone that if there's anything I learned in a pretty big series of thousands of gynecomastia patients, is that don't underestimate how well that skin goes back. I have learned that, and so that's kind of a gift that you all have brought to my world, because I've seen so many people, and I've learned that I don't underestimate how well that skin goes back, and I actually have the first-hand experience. I mean, there are cases where it didn't go back as well as I thought it would. There are tons of cases where, man, I was just shocked and I'm blown away. So sometimes if I question it, I'll just give you the benefit of the doubt. Thanks for watching, and thanks for being informed.